do here is to label your gel card with the patient's name and any number that would identify it. Okay, the next thing you need to do is label your wells here 1, 2, and 3 that correspond to your screening cells 1, 2, and 3 that you have in front of you. And that's what you're going to be putting into your gel card along with your patient's serum. And then we need to expose our wells. So you're going to take the card here and rip off the aluminum foil through the first 3 because that's what we're going to be using right now. So go ahead and do that. And you can just fold it over then after you expose the first 3 wells. Perfect. And just fold it over and maybe onto itself then too. Great. Okay, so the procedure for doing an antibody screen or a panel in a gel card is you have an IgG gel card. So in there is LIS and also anti-IgG antihuman globulin. So we'll set this back in here. And what B is going to do is put 50 microliters of his screening cells 1, 2, and 3 into the corresponding wells that he has labeled 1, 2, and 3. After that, he's going to add, the procedure requires us to use 25 microliters of the patient plasma in each of those. However, we don't have a 25 microliter pipette, so we're going to use 50 microliters for that as well. So the first thing he's doing is mixing up his reagent screening cells, and then he's going to invert them as well to make sure that all the red cells are settled from the bottom. Then in order from 1, 2, and 3, he's going to add 50 microliters in each well. There we go. Okay. And just put it right in the first well. And push it in there forcefully so it all goes in there. That's perfect. Now we're going to dispense that tip. Okay, close up our screening cells right away so they don't spill. And then we're going to do that for the next 2. And since you already mixed all 3, there's no reason to mix it again. Not yet. If there's a bubble up the top, that's okay. Okay, dispense that one, and now to the third one. Okay, after all 3 of the screening cells are in there, now if you have a 2-cell screening panel, there'll only be 2 wells that you're going to use, but we're using a 3-cell screening panel. So now he's going to take the patient's serum, and using one tip, he's going to carefully pipette 50 microliters in each of the wells he had his screening cells into without putting the tip into the well to contaminate the tip. Otherwise, he has to change the tip each time. So go ahead and do that. So this is sort of the opposite of how we do things in tubes. Remember, in tubes, we always add our serum first, or plasma, followed by the cells. But in gel, we do things a little bit different. Okay, he's finished up his pipetting, the second well, and then introducing the plasma for the third well. Okay, great. We're going to dispense that tip, and then it's a 15-minute incubation for gel cards. All right, we're going to incubate our gel card in this incubator here that is designed for that. So we're going to lift up the lid, and we're going to set it in there in any one of the slots, and then close the lid. Okay, and then once we get back to our station, we will set a timer for 15 minutes. So since the antibody screen is positive, we need to do a panel to do an antibody ID. And B is going to take the panel here and mix it by inverting it fully 180 degrees until all the cells are reconstituted or mixed up real well. And after we do that, we'll just take one of them out to make sure that all the red cells are suspended from the bottom. So B has his patient's initials and date of birth, everything labeled on the gel cards for the panel. And if you notice, this panel is designed for exactly 2 gel cards fully, 2 IgG gel cards. The first one is labeled as 1 through 6, and the other one's labeled 7 through 11 with the auto control at the end. So what he needs to do, what we also have here, besides the plasma, is that we have 1 drop here of the patient's red cells in a 3% suspension. Because gel uses a 0.8% red cell suspension, that's what all of these are. So that's the difference between tubes and gel too, is that these panel cells, if you notice here, you'll see that it's a 0.8% suspension at the top there, and also on the screening cells. So that's what we use here. Now, what B needs to do is dilute the 3% cells in this tube here to a 0.8. So we have 1 drop of patient cells right now, and what he needs to add is 4 drops of saline to this to make it a 0.8% suspension. So that's 4 drops. Normally we use a special reagent called MTS diluent tube 2 for this, but we don't have that in this lab, so just 4 drops. Now just mix it up a little bit, and that'll be for our auto control at the end. Okay, so now we're ready to add our cells first. So we're going to put those back upright, and we're going to rip off the entire aluminum foil on both of those. And then using a different tip for each one, uses several tips. We're going to start with the front left. That's going to be cell number 1 from our panel that we already pre-mixed. So he's just going to take that out, open it up, and then pipette 50 microliters of the panel cell number 1 into well number 1 that he has labeled. And you can even go in there at an angle as well. And push it in there with force. All right, perfect. And then we're going to continue to do that all the way through cell number 11. Okay, we have one more cell here. This is cell number 11 that we're on. And remember, guys, these panels or these gel cards here are designed for a 12-cell panel. Since there's 2 sets of 6, so your panel comes with 11 cells, the last well always being for your auto control, which remember is patient cells plus patient plasma that will detect an auto antibody. Okay, so number 11 is finished, and now we're just going to remix up your 0.8% suspension of your patient's red cells and pipette up 50 microliters of that, just like you did the panel cells. Okay, now we're ready for the patient plasma. And that, again, just like our screen, will be 50 microliters of your patient plasma in each of the wells, including the auto control. Forcefully pushing it in, but not contaminating the tip at all. So you can reintroduce it into each one. Now, if you guys do use gel in your lab, more often than not, you either have an automated instrument that does this, called a Vision or a ProView perhaps, or you have an electronic pipette that dispenses 25 into each well with a push of a button. All right, so he's going to continue to do this for all 12 wells. All right, now he's on the 6th one, or number 7 rather. Thank you. All right, perfect. And now we're going to take those two cards and put them in the same incubator we put the screening cells in.
What about the one that's finished?
All right, the one that is finished, so we're going to put those two in there, our panel. And for our screen, that one, the timer did go off. I don't know if you guys heard it earlier, but our timer did go off on that one, so we can take that one out. We can close the door for those other ones. And we're going to open up this drawer and centrifuge it down. And we're going to use this extra gel card right here to balance it. So just stick it right in there and push it all the way down into one of those slots. Perfect. Now I'm just going to spin that by hand to put the balance tube on the opposite side. And then we're going to push this in forcefully. Good. And then we're going to hit the start button.
Start.
And it'll spin down at about 900 RPM for about 10 minutes. Alright, so what B is going to do is a selected cell panel. However, we just need one cell here in order to fulfill our requirements from our procedure. So we're going to use the first well here only. And that's going to be cell number 22 right there. Yep, and so we're going to just follow the same procedures we did before. And usually if I want to save the rest of the wells, I write down all my other information just below the well that we're going to use. So like date of birth, real tiny, or the last 2 digits of the medical record number, that's okay as well. And then we're going to do the same procedures we did before, only using just one cell. Alright, those are done centrifuging, so B is going to take them out and bring them back to our station here to be read. So the balance can just come out and lie right there. And let's take a look. And oh, we have a positive antibody screen, right? So we have, let's see if I can get this in focus here. So here we have a positive, and we know that it's positive because the gel stops any agglutinated cells from going through. So you can see that this is positive here, this is positive here, but this is negative. The cells went all the way through the gel to the bottom because there is no agglutination. So we're going to record these results on our answer form. The advantage here is there is no immediate spin, there's no 37 degree. The only thing we have to put on here is gel and then IAT on our form. There is only one phase that we read here, and there are no check cells, so very standardized, very easy procedure to follow. And to record these reactions, here's a copy of the 3-cell, the antibody screen anagram, and here is we're just going to put on the top of this gel, right up there, and then here, or you could put gel right here or IAT right in this first box next to cell, and then we put our reactions right down here then. So he's going to record his reactions in. Cell number 1 was a 3, and we're going to put a 3+ as well. That's a 0 and then another 3+. So we're finished interpreting our antibody screen. Now we're going to wait for our panel to come out of the incubator and the centrifuge to interpret that and to do our rule outs. So we took the gel cards out of the centrifuge and they are finished, and it looks like we have some positives and negatives here, so I will post pictures of those for interpretation. You want to take the other one out too. That's for their selected panel if we need to do that. Alright, so looking at this, looks like we got very similar reactions as our antibody screen. So again, our we have a 3+ here, and probably all negatives from 2 through 6. We have a negative in 7.
9's like a 4.
9's like a 4+ with a straight line at the very top. Nothing wants to go through there. 8 and 10 might be a 3. You can see a little bit of a dip down there. Of course, 11 is 0, and there's our auto control, which is negative as well. So he's going to go ahead and record those reactions and then continue to do the panel.